All right. This is to answer the question on how to do um, the current discussions for MED 120 medical terminology. This is Dr. Garais, your professor. And I just also want to make a quick thing here. Any Zoom links or video links are here. They're in announcements, they're up here. Okay, with that being said, let's jump right in to discussion 2 and then discussion 3. So, of course, it's located module 2, discussion 2. I go in there and I click on discussion forum. And then if you look at my discussion 2, it'll state kindly look over the cardiac cases at the end of the chapter, write a short quiz of 5 multiple choice questions, and submit via Microsoft Word document. So I can go in, right? I go into the main page. I go into my medical language lab, and let's say we're doing the cardiovascular. I go into my ebook. That loads up. All right. Here's my table of contents right here. I click on that. Of course, accept cookies down here. That's annoying, but that'll deal with it. And then I'm going down here. And then I'm going to go to the chapter that has the cardiovascular because that's the one for discussion 2. So when I click on this little arrow, it brings me to all the things that are going on in this particular chapter. Right? And then when I go down, do you see all the way at the bottom it says medical record activities? I click on that and I pick one of these medical records. I click on that. And do you see there's an emergency department report? Now, your questions, your multiple choice questions that you're going to create, because it's good to be able to preempt your professor, to get into my head, to know what I most likely will ask. And one of those things that on future exams is you have to be able to read a report and then be able to answer typical questions. So when you look at this report, right? Patient's chief complaint is chest pain. So I could have a question, right? And let's open up my Microsoft Word. And right off the bat, we know that there's medical terms for chest pain. So could I write a question regarding that and a multiple choice with 4 items? So I could ask, what's the patient's name? Mr. Nichols, right? Okay. In the cardiac case, what was the chief complaint of our patient, Mr. Nichols? Was it myocardial infarction, dyspnea, aneurysm, D, angina? So if we look at the case, it's chest pain, right? That's the answer. That was the chief complaint. Is myocardial infarction chest pain? Nope. That's a heart attack. Is dyspnea chest pain? Nope. That's dyspnea, also known as SOB, shortness of breath. That's not it. Is it an aneurysm? Nope. But angina. Isn't angina chest pain? Secondary to some exertion? Yup. So, best answer would be angina. So you can go through all of that and you could kind of do things like that. Like you could also ask a question about what does PRN mean? Look, he had a myocardial infarction. So what did he have? He had a heart attack. When? January of 19 whatever whatever. And then again in 19 whatever whatever. So how many heart attacks did he have? 2 of them. What was the source of the heart attack? And you could say, look, illegal drugs. And you could do that for all of these things. And because that's the real test. No one's really going to ask you, What's the suffix of this word? Of course, we do that for academic purposes for this class, but ultimately, they're going to ask you questions from this. What labs did we perform? CBC means complete blood count. Chemistry profile means a whole bunch of chemistries, cardiac enzymes, and all of them were what? Within normal limits. Normal, if you break down the word, right? Let's go here. Norm, al, pertaining to the rule. So the rule is you should be where? Within normal limits. You shouldn't be too much, your blood count, or it shouldn't be too little. So these are the kind of questions that you need to create, and you could utilize it. And one thing that could also help you in these cases is this. They provide you right after what are the nice medical terms that you could ask. Also down here, can you easily take these questions here that are fill-ins and create multiple choice examinations? What was found during the clinical examination? A, B, C, D, right? What was the cause of the patient's prior myocardial infarction? Was it A, congenital heart disease, B, illicit drug use, C, a gunshot wound to the chest, D, all of the above? And of course, best answer is B, it was illicit drugs. He's a drug addict and he likes taking cocaine. All right, so you could also do that for the next case. So read all the cases on every chapter that you have. Go to the medical record activities in the back because those are all your discussions going forward. All right, I hope this cleared it up. All right, and see you online.